Hello and welcome to Ask the Native Doctor. My name is Isaiah Meders.
And I'm Hannah Redlich.
We're here today demystifying COVID-19 in California Indian Country.
Last week we talked about how vaccines work. Today we're going to talk about how we can prepare ourselves to receive the COVID-19 vaccine. What questions should we ask? Can we help our bodies in any way? Dr. Sophie Neuner is going to answer these questions for us.
Good afternoon, Dr. Neuner, and welcome to our show. We're very, very happy to have you join us today. Can you please tell us a little bit about yourself?
Good morning. I'd like to introduce myself in my traditional language. Ayuki nanitwu di Sophie, wa Karuk wa arar, panam nagmiaram sibra. So I just said, hello, my name is Sophie. I'm a Karuk person, and I am calling in currently from Panamnik, otherwise known as Orleans, California, in Northern California, which is Karuk ancestral land. I'm also a physician and a public health practitioner, and currently a research associate at the Johns Hopkins Center for American Indian Health.
We're really excited to have you here today. We're so excited to be having this discussion. So, I think one of the things that really intimidates me when I'm approaching something new within the medicine realm is that sometimes I just don't even know what questions to ask. I don't know what information is important for me to understand in order to make an informed decision. So, with your experience, what do you feel are really important questions for us to ask our healthcare providers about the COVID-19 vaccine?
So first of all, Hannah, thank you for that question. And I wanted to let you know that you are not alone. I think that's completely normal. Specifically in this pandemic, we've been hit by so much information all the time. Sometimes guidelines change, which really reflects the scientific process. So it's a good thing, but for the public, it can be extremely confusing. So I think your question is excellent. There are a few things that you can ask your provider and a few things that you definitely should ask your provider. So things that you can ask your provider, literally everything. Ask them any questions that you have about vaccine efficacy, which vaccines you're going to get. But specifically, there are a few things that you should be thinking about when you ask your provider. So one is, have you had an allergic reaction to a vaccine before? If you have had a severe allergic reaction to a vaccine, that is definitely something that you want to talk to your provider about. I want to say here that, severe allergic reactions to all the COVID-19 vaccinations on the market are extremely rare. To put it in perspective, the chance that you're going to have an anaphylactic shock, meaning a very severe reaction to a COVID-19 vaccination, is kind of similar to the chances of being struck by lightning this year, so not a lot. For the Pfizer vaccine trials, it was about 11 people in 1 million, Moderna, I think 2 or 3, and Johnson & Johnson vaccines, I think there are several studies still showing that, but in clinical trials, severe allergic reactions were extremely rare. That being said, it's a great idea to bring it up with your provider if that's something you're concerned about. And things that you can specifically ask your provider is, do you have the medications and trainings on board to, mitigate severe allergic reactions? Meaning, do people have EpiPens? Are they trained to respond to severe allergic reactions? And your provider might ask you to actually stay on the vaccination site for up to 30 minutes if, there is some concern that you may have an allergic reaction to COVID-19. So that's a big thing. Allergic reactions, definitely ask your provider about that if you have concerns or have had severe allergic reactions before. Another thing that you could ask your provider is if you're pregnant or breastfeeding. I think providers can definitely help you, make that decision for yourself and for your child. So I think we're going to talk about that a little bit more later. But that's definitely a question you can ask your provider. Finally, I would encourage anybody with an underlying medical condition to talk to their provider about getting the vaccine. A lot of underlying medical conditions, Hannah, diabetes, obesity, high blood pressure actually lead to more severe COVID outcomes. So for folks who have those underlying conditions, getting a vaccine is super important. If you are immunocompromised, so you have a weakened immune system, either because you're taking medication or maybe you're undergoing chemotherapy, that's also something that you might want to bring up with your provider, because the COVID-19 vaccines aren't live vaccines, there's no theoretical concern that it could cause COVID-19 in your body, even if you are immunocompromised. So the vaccine is probably safe, but clinical trials are still out on that, and that's definitely something that you could make an informed decision about after speaking to your provider.
Okay, great. So that's good information. And one of the things that, our job here is to kind of bring this for the everyday person to kind of understand. So we have a scenario for you. You know, a lot of our families in Native country, multi-generational. So you have grandma, you have your middle age, and you have your youth running around. And the discussion of vaccines being available to our families now, and sometimes that means some of our family is getting vaccinated first or later. What kind of discussion should we be having with our family? Where does that start, and how does that move into vaccinating or not vaccinating, or whose priority?
Yeah, absolutely. So in terms of prioritization, that's mostly up to state health departments and tribal health departments. So I think as individuals, we have little say in terms of like who's going first. But here are a few things that you can do when you talk to your family about vaccines. There's a big amount of misinformation, and I don't know how it is for you guys, but sometimes it's important. If sometimes family members will bring up concerns regarding the vaccine. And if someone brings up a concern, it's really important to, listen to them and meet them with empathy, especially if someone is coming to you with information that seems like it's misinformation or that it seems like it's untrue. It's important to listen to their concerns rather than, right off the bat jumping into, that's wrong because blah, 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 blah. Because that can actually turn a lot of people off from getting the vaccine, or even like listening to, reasoning about why we should get the vaccine, right? So it's important to meet people with empathy. And then you can ask your family members if it would be all right for you to share information with them. And you can share information with your family members from, various trusted sources such as the CDC. Johns Hopkins Center for American Indian Health has some really good resources for folks looking for more information on the vaccine, and in particularly dispelling some of the COVID-19 myths. So yeah, giving people right information is also key.
So last week we spoke with Dr. Antoinette Martinez about how the vaccine actually works and trains our bodies and our immune systems on how to fight the virus so that when it encounters it later, it will already know what to do with it. So I was just wondering if there's any way we can help our bodies create a really good antibody response when we receive the vaccine. Is there anything we can do before or after that will facilitate our bodies in that?
Yeah, absolutely. That's also a wonderful question. So in terms of whether there's supplements or medications you can take before or after, we don't know whether any supplements or meds are more effective than not. And at this time, I can't recommend anything. But it's really important to get an adequate amount of sleep, to get proper nutrition, especially in the weeks leading up to getting the vaccine. So really making sure that you're eating, fresh fruits and vegetables, that you're getting a lot of vitamin C in your system, that you're treating your body right, doing exercise, and getting enough sleep, because all those things are so important for helping your body build up a proper immune response. And when you get your vaccine on the day itself, maybe it's important to realize that, your body is literally building up all the magic that helps us fight COVID-19, and also, moreover, your body is about to build an immune response that will protect you, your family, and your community. So give your body some rest. Get your antibody on. It's really important to just, listen to yourself, maybe do some light exercise, make sure that you're drinking lots and lots of water. That'll also help with side effects such as headaches. And that's another thing. So I've heard some people, recommending taking Tylenol or, other like anti-inflammatory meds before getting the vaccine. That's actually something that is not recommended. But if you are one of those people who did that, you're going to be fine. Your body's more than likely still produced a good immune response in response to the vaccine. So you're A-okay. But, just realize that your body is doing its part to help fight this pandemic and end COVID-19, and that's awesome.
Yeah, that's good to know because when he was receiving the vaccine, we kind of have this little concoction of immune boosting supplements, and I was thinking, I don't know if it's beneficial to take this when you're also receiving the vaccine. On one hand, you want to help your immune system out, but on the other hand, you don't want to send it into overdrive or get rid of some of that inflammatory response that might be helping produce the antibodies. So I was like, I don't know, maybe we should just hold off. But I'm glad that we did the right thing and that whole foods are always safe.
Yeah.
And yeah,
I think the gyms out there, like when you start working out again, it's like 12 supplements you bring home the first day you go to the gym for the year, and it's a little bit overwhelming, and also, it's kind of hard to know, like, at that point in time if you should take more of a natural approach and just keep your basic, like you said, hydration and well nutritional balanced meals and things like that. But yeah, I kind of overdo the supplements when I go to try to start working out again, but they're still sitting in the cabinet.
It could also be a good time to tap in some of our traditional medicines. I'll mention elderberry as an example. You can definitely say drink some teas before and during your COVID-19 vaccination, not during the vaccination itself while you're getting a shot, but, as your body is recovering and building up antibodies and building up immunity. And that can be a really good way to tap into some of our traditional knowledge.
That's great. My mom actually is a dietitian, so my family has always been really interested in alternative medicines and using food as medicine. And I wasn't really familiar with a lot of Native American traditional foods, but when I moved out here, I was just astounded at how blessed this region is in terms of resources and how many nutrients. We just did a segment on some of the nutrients that they're prescribing for people who are suffering from COVID, and pretty much the Native American diet of Northern California covers it all, and that's just amazing to me.
Yeah, it just stands to show how powerful our connections to land are in supporting and building our health and the health of those around us.
So I know your passion is about women's and family health, so I'm sure you receive a lot of questions from pregnant and nursing mothers about how it will affect them and also affect their child. Will the child receive antibodies as well from the mother? Will there be any effect on the fetus?
Yeah, absolutely. That's a great question. So that sort of, is an important thing to think about, right? Like if you are pregnant or breastfeeding now, you're likely having to make some big decisions. And I think acknowledging that can feel overwhelming is really important. That being said, there is no indication just based on the science of the current vaccines that they would be in any way harmful to you or your child. That is, if you are pregnant or you are breastfeeding. The American College of Obstetrics and Gynecology recommends that women be offered the vaccine, meaning that you should be able to receive the COVID-19 vaccine, in particular to protect you from bad COVID-19 outcomes, which we do know that pregnant women are more likely to suffer from. So getting the COVID-19 vaccine might be extremely important if you're pregnant or breastfeeding. But that being said, there haven't been, rigorous clinical studies in populations that are pregnant or breastfeeding, meaning that trials in pregnant and breastfeeding women are still starting. So this question is a really important one, and it's definitely one that I encourage you to talk to your provider about, and they can give you a little bit more facts and figures. That being said, and I want to repeat this again because I think it's really important, there's no indication that these vaccines are in any way harmful to you or your child if you're pregnant or breastfeeding. The second part of your question was sort of about antibody response, and that again, it's hard to say anything definitively, right? Because we're still waiting on clinical trials and results from those clinical trials. But just based on immunology, it does seem that if you as a pregnant mother or breastfeeding mother will receive the COVID-19 vaccination, you will give some of that immunity that you've built up to your child, be it through breast milk or be it through the placenta.
Wow, I do remember reading an article recently about the first child being born with COVID antibodies. And I know that that hasn't been studied enough for anyone to say that, yes, it's definitely what happens. And, there's no peer-reviewed articles on it yet. But I do remember reading an article that they had tested and a newborn actually did have those COVID antibodies, which is amazing to me that our bodies are such a miraculous.
Bright.
Yeah.
It's amazing. We were curious too, up there in Orleans. How is that community? How is your family? How is your community doing up there with COVID response so far and vaccinations? How is that going in your region?
Yeah, the Karuk Medical Clinic has done a really awesome job in making vaccines available to us in our communities. So when the vaccine rollout started, our tribe declared elders everyone over 55. So everyone over 55 was eligible, and that's so important because a lot of our elders are knowledge carriers. Some elders speak the language, and we really want to protect our elders out here. But now the vaccine has been rolled out for the entire community. The Karuk Medical Clinic has organized some really successful vaccine drive-thrus, and I'm really happy to say that my entire family has been vaccinated, and that has been I can't tell you, just so amazing. I feel like all of our mental health is so much better, even though we're still being safe and keeping our distance from other households, specifically, people in households who have not been vaccinated. It's just great to know that we can now, gather as a family again. We have big family dinners. I'm really lucky to have, my aunt, my uncle, my mom and dad, my grandparents, we all live pretty much in the same neighborhood. And that has been so amazing to just be able to interact with family members without having to worry about giving people COVID-19, without having to, eat
Right.
outside, wear masks, etc. So that's been amazing.
Wonderful. And one last thing I wanted to ask you, with the history that we know of with Native Americans and government programs and the past that we've had and all that, what has been one of your most challenging obstacles with COVID-19 and the trust of the Native community, and you being in the medical field as a professional? What are your thoughts on that?
So thank you for bringing up that important point, Isaiah. It's really important to acknowledge the fact that Native peoples have profound and valid reasons for mistrusting the medical and public health community. And that is really something that I try to bring into all my conversations, particularly if people are mentioning worries like, the vaccine is just something to kill us off, which sounds radical, but I hear that in my community, and I think there are some real reasons for hearing that, That being said, it's important to realize that now, thankfully, a lot of our physician force is Native, at least in Indian country, our physician force is in part Native. Native participants participated in the vaccine trials. Thank you to those folks, and because we have had so much Indigenous participation in everything, in like everything vaccine, from developing the vaccine to testing the vaccine to vaccine rollout, I think that we can feel a lot more confident that we have in the past that this vaccine is something that is important for our communities. Another thing I would like to bring up is that, some communities have had the highest vaccination rates in the whole entire US. So Navajo Nation is actually right now leading the US in terms of vaccination rates. And they're pretty close to herd immunity already. And we have already seen, the rates of COVID-19 deaths and hospitalizations plummet in those communities, Isaiah. I actually yesterday pulled up a CDC graphic on COVID-19 hospitalizations, and Native Americans, even though we actually have suffered the worst in this pandemic, we now are the least likely to be hospitalized for COVID-19.
Wow, that's amazing.
Isn't that awesome? And to me, that is just testament to the vaccinations being so important and successful. And it's also testament to our tribal communities who have defended our tribal sovereignty, and through this sovereignty have been able to lead the nation in terms of vaccine rollout. So that's a big success.
Yeah, and thanks to medical professionals like yourself leading the way too. That's a big part of all of this happening, and having Native professionals in the medical field is, that to me, with this podcast idea, that was one of the first things that Hannah and I brought up, is like, we need to get every Native American doctor in California, and we need to talk to them. We need to get them on this show and let them speak their mind and share their experiences, and that we feel like we're very proud to be a part of the movement too, and thank you for doing this show with us as well. This has been great.
Thank you too. I am so excited to be a guest on the show, and I am also really excited to listen to other episodes featuring my incredible colleagues.
Thank you for joining us today. This podcast was sponsored by the California Rural Indian Health Board.
Do you have any questions we haven't answered yet? You can film yourself asking a question and submit it to epicenter@crib.org for the possibility of being featured in one of our episodes. Thank you so much for tuning in.